Welcome to the Friends of NPACE podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com. Welcome to the Friends of NPACE podcast. My name is Josh Plotkin. I'm the Chief Operating Officer at NPACE, and today we have a very special episode that has two guests joining us. Our first guest is Dr. Karen Myrick, and Dr. Karen Myrick is a board-certified family and orthopedic nurse practitioner, educator, researcher, and nationally recognized leader in musculoskeletal education and nurse practitioners training. She specializes in orthopedics and sports medicine and practices at Orthopedic Associates of Hartford Urgent Care, providing expert care. Karen, Dr. Myrick, we're going to refer to Karen Myrick as Dr. Myrick for the rest of this podcast because we have two Karens joining us. I'll introduce the other in just a moment. But Dr. Myrick serves as a Director of Nursing Education and Practice at Springer Publishing, where she leads the development of innovative learning resources for nurse practitioners, including national review programs for FNP and AGNP certification. She is also the Program Director for the Postmaster Certificate Program in Orthopedics and Sports Medicine at Mass General Hospital Orthopedic Academy and holds tenured faculty appointments at multiple universities. She's an author and of multiple textbooks, including orthopedic and sports medicine case studies for advanced practice nurses. And Dr. Myrick has published many peer-reviewed articles and original research focused on musculoskeletal care and advanced practice education. She's a fellow of the American Association of Nurse Practitioners and the American Academy of Nursing, and is dedicated to advancing clinical excellence, research, and leadership within the nurse practitioner profession. And our next guest is Karen Nicholson. And Dr. Karen Nicholson is a principal scientist in U.S. medical and scientific affairs at Haleon, with over 15 years of experience driving evidence-based innovation in consumer healthcare. As subject matter expert in topical pain relief, she leads medical strategy, evidence generation, and scientific communication for brands such as Voltaren, arthritis pain gel, and Advil targeted relief. Her career includes roles at Haleon, Reckitt, Pfizer Consumer Healthcare, and Johnson & Johnson, contributing to RX to OTC switches, clinical development, scientific publications, and cross-functional medical leadership. A Princeton-trained PhD chemist, she has authored peer-reviewed publications across pain management and related fields and presented at national conferences. She holds board certification as a medical affairs specialist and certificates in biopharma innovation, medicinal plants, and AI and research. Dr. Nicholson looks forward to joining the NPACE podcast to share insights on Haleon's OTC options for pain management. And as I mentioned a little bit earlier for our listeners, and more importantly for me, is since we have two fantastic Karens on the show today, we're going to address Karen Myrick as Dr. Myrick throughout the episode, and we'll get into our conversation in just a moment. We'll address Karen Nicholson as Karen as we move forward. I do want to give our audience a brief background on the NPACE and Haleon partnership. Haleon is the presenting sponsor of the Friends of NPACE podcast. We're thrilled to have them as our presenting sponsor. And NPACE and Haleon partnered in 2025 to provide advanced practice providers with information and resources on Haleon healthcare products and services. They're a leading global healthcare company and committed to providing better everyday health with humanity, with brands such as Advil, Voltaren, Excedrin, Sensodyne, Flonase, and Centrum, and many more. Haleon provides education and resources to advanced practice providers and patients on their pain and product portfolio. For more details, you can visit haleonhealthpartner.com. Lots of information there. Before we dive into our conversation, Dr. Myrick, how are you doing today? Great to have you with us. Thank you for being here.
Doing great, Josh. Thank you so much for having me. What a pleasure.
Excellent. And Karen Nicholson, how are you? Thanks for being with us today.
Thank you for having me. Looking forward to the discussion.
Excellent. So let's set the table a little bit here in terms of our discussion and what we're going to be doing. So today's episode is going to be a great conversation regarding a few different patient scenarios with Dr. Myrick and Karen. And what we're going to do is discuss the scenario, and then we're going to go to Dr. Myrick for her take in terms of how that patient would be addressed from a medical standpoint. We'll go to Karen Nicholson to discuss how products within the Haleon portfolio could be integrated to the treatment plan. And then if we have any wrap up or comments that we want regarding the patient scenario and what we've discussed, each of our guests will be able to comment on that. So without further ado, let's get started. I'll present the scenario and then we'll go to Dr. Myrick first. So our first scenario is we have a patient who's in their mid-30s, is physically active with routine gym exercise, 3 to 4 times a week, and is also playing in a competitive recreational basketball league. Recently, this patient has begun to experience knee pain that started to present itself after having lower body weight exercise days, and it's even worse after the basketball games. The pain is intermittent, but this patient is concerned if they don't take action, it could begin to impact their regular day-to-day activity. So, Dr. Myrick, let's start with your sort of medical feedback and analysis of this patient scenario.
Absolutely. This is kind of a common patient that I think I might have seen this weekend, but really a common situation. So in a patient like this, the first thing that I'm thinking is this an overuse type of pattern or a structural injury? Based upon the history that I'm hearing, it sounds like an overuse type of pattern. In primary care and in sports medicine, we see this an awful lot because people sometimes have changes in their lives, the weather changes, and everybody's out doing their thing. When this happens, there's a little bit of an overuse type of pattern that we see because people are really going a little crazy because they finally can. So this can lead to issues like irritation. You're smiling. I think you might be doing this yourself. So, people are they can develop overuse injuries, patella tendon things. They can have patellofemoral pain syndrome. They can develop patellar tendonitis, even quadriceps tendonitis. It's very common. The first step is really to assess in great detail their patterns of use. So maybe get a little diary, listen to them a little further, and listen to what they've been doing on a daily and weekly basis. At this point in time, this patient is presenting with discomfort, and oftentimes they're concerned that they've torn something. I'm not hearing, one episode of a dramatic injury where they had some type of event. This is more just kind of an insidious onset of pain. That being said, too, I want to look at the patient to assess their training load. I want to look at their biomechanics. Are we dealing with somebody who's got really flat feet, really high arches? What else is happening? How do their hips move? That kind of thing. And then I want to just see that this is likely, as I listen to him, it sounds like this is more of a pattern of inflammation and overuse over time. And again, not uncommon in this type of patient at all. I also would make sure that, when I'm talking to my nurse practitioner students and my medical students, that I want them to understand that a patient that presents like this, that training load is so key, and understanding where they're coming from and what they're doing on a daily basis. If we can control their inflammation, oftentimes early in this overuse type of pattern, we can get them back to their activity sooner, and we don't want it to lead to a more serious injury. So getting their inflammation under control would be key in this type of patient.
Excellent. Dr. Myrick, thank you for breaking that down for us. Let's shift over to Karen Nicholson. And Karen, let's discuss the Haleon products that may be considered in a patient presenting these sort of complications.
Sure. And before I get started, I just want to, emphasize that any patient who is going to be taking any medication, even OTC, consult your healthcare provider first, make sure it's right for you and fits in with any other treatment plans that you have for any other conditions. So that being said, I can think of a couple of great products that we have in our portfolio for this type of a patient. The first being, the iconic Advil terracotta round tablets that we have. We have a couple other formats. We have a caplet, which is more of an oblong shaped tablet, as well as some liquid gels. So any of those would be perfect for this patient. They contain, each caplet, tablet, or liquid gel contains 200 milligrams of ibuprofen, and ibuprofen is an non-steroidal anti-inflammatory drug, an NSAID, and I'll get to how those work in a second. And the dosing would be 1 or 2 tablets every 4 to 6 hours, and you would take only a maximum of 6 in any 24-hour period. The reason this is a great drug, ibuprofen, for this type of a condition, is that Dr. Myrick mentioned, inflammation associated with this kind of injury. And while Advil is not indicated to treat inflammation, it is indicated to treat pain associated with or caused by inflammation. And so what does that mean? Well, when you have an injury such as this, arachidonic acid is released into your cells. And 2 enzymes that are called COX-1 and COX-2 take arachidonic acid and turn it into a whole bunch of factors that are involved in the inflammation pathway, one of which is prostaglandins. They have a number of functions, but for this discussion, what's really important is that they're the pain signaling chemical associated with inflammation. And so ibuprofen and Advil works by blocking production of those prostaglandins, thereby reducing the amount of pain signaling, and in turn giving temporary pain relief to the patient. So it's really perfect for this situation. Another product that would be really great for this as well would be a topical product called Advil Targeted Relief. And I would say this would be great for patients who have trouble swallowing pills or just don't like taking a whole lot of pills, right? Don't want to take a lot of medicine in their body. So this is a combination of 4 what they call counter irritants. It has menthol, methyl salicylate, capsaicin, and camphor. And you might notice a lot of gels and creams and patches on the market with combinations of these various ingredients, very similar ingredient profiles. What's unique about Advil Targeted Relief, it has 4 ingredients. I think we're the only ones on the market in the US that has a 4 combo formulation. And the way these products work is when you apply them on your skin above the site of pain, it causes either a cooling or a warming sensation. In the case of Advil Targeted Relief, it causes both, so it has a dual sensation. And then that sensation distracts your brain, I should say, from the pain signaling. So it's a really cool mechanism of action, and you can apply it topically exactly where it hurts, and you don't have a ton of medicine floating throughout your body, which some people are trying to avoid these days. So I think those are the two that come to mind for this patient.
Excellent. Thank you, Karen. That's great. And I think it's great to know that there's different options, and certainly, as you mentioned off the top as well, depending on what other medications folks may be taking, they may be choosing one or the other there. So I'm going to kick it back to Dr. Myrick and sort of wrap up this first case here. So Dr. Myrick, what should this patient be doing with their medications, and then anything else that they may be doing to be able to continue the regular exercise routine and continue to hopefully put up some good numbers in that basketball league?
Well, I think the last part that you said there, it's really so important that we are enabling our patients to stay active. That is probably one of the most important things. We have a saying in orthopedics is you're either going to see your orthopedist or your cardiologist. And I think I'd much rather have all of my patients seeing me than seeing a cardiologist. So that being said, for many active adults, the goal really is about staying active while allowing the body to recover. So in this case, his knee needs to recover a little bit. So I would typically recommend a very short period of, hear me clearly, activity modification. Not telling you to stop, right? So I'm not saying stop. We're saying keep going, but we need to modify so that the body can heal. So rather than complete rest, we want them to keep moving. That might mean temporarily reducing some of the high impact activities like jumping or sprinting. So maybe they're working on their foul shots, I don't know, they're 3 points, but they're doing something to stay active. But jumping, sprinting, those will cause a little bit more stress on that knee. And they can also focus on strengthening and mobility work which is key, especially to longevity. Ice, stretching, strengthening the quadricep muscles, the hip stabilizers, the core, this can really make a significant difference. For patients with inflammation that limits their activity, a very short-term use of an over-the-counter anti-inflammatory would be a great idea. Something topical is going to be extremely helpful and keep them moving. It'll reduce their symptoms while it allows them to keep going and maintain their activity. And then we can work on addressing anything that's underlying biomechanically. And then what I really try to emphasize a lot with patients is that managing their inflammation and discomfort can prevent any of these small issues from becoming larger issues and taking them out of their sport for a longer period of time.
Excellent. So some great tips there from Dr. Myrick in terms of how to address this patient, not completely stopping their activity, but giving them a chance to modify and hopefully improve and strengthen up that knee in that scenario. Karen Nicholson, any final comments on this one? Or are we ready to move on to the next scenario?
Yeah, I would say one thing I forgot to mention is with both of these products, if you're still feeling pain within a week to 10 days after starting the therapy, you should definitely consult your healthcare provider right away because it might be something more serious.
Smart.
Excellent. All right. So there's scenario number one. And Karen, Dr. Myrick mentioned, that you're smiling over there, Josh. May or may not have tapped into some personal experience there with our first scenario. But let's move into our next one. And this is a scenario where we have a patient that's 58 years old and they had an accident while skiing in their late 40s. They tore both their ACL and MCL in this accident. They had reconstructive surgery and attended physical therapy, but recently this patient has started to feel pain in their day-to-day life, and it's limiting them from being able to do certain activities such as taking the stairs, doing work around their house, so things like gardening and yard work and sort of day-to-day things that go along with the house. And most importantly, these folks are also expecting grandchildren soon, and they want to be able to be fully engaged in activities with them and all the things and joys that come along with having grandchildren. So, Dr. Myrick, we're going to start with you. This one's a little bit different than what we just discussed, but your medical feedback given the reconstructive surgery and physical therapy, and we're, almost 10 years past that, but the lingering effects, if you will, of what happened are starting to creep back into this situation.
And, I think we've chosen very good scenarios because this is something else that is not uncommon in any way, seen oftentimes in clinical practice. So it's a very high yield scenario. And so, patients who have any type of their joint disrupted during surgery, any prior injuries, it's something that we need to set up expectations at the time. It's not uncommon. This kind of post-traumatic issue is very real, especially somebody who's had a ligament reconstruction in their 30s or 40s. They can develop degenerative changes later in life for sure. Even when surgery and rehabilitation, all guidelines have been followed perfectly, the surgery was successful, the joint still has been violated, and so therefore that wear and tear over time, the risk is very high. So in a patient who begins pain with like stair climbing, gardening, or other activities, this is usually something that we think about once we get their history. They've had this type of injury in the past, they've had surgery, and we start to go down that path of really thinking it's early degenerative change or post-traumatic. The goal here would not be just pain relief, but also preserving their mobility and maintaining their strength. So there's a bit of a theme. That's what we really like in orthopedics, is to keep people going as best as we can. And we want to have them doing their activities, getting ready for that grandchild and staying as physically healthy as they can so they're able to enjoy that grandchild as well.
Excellent. And Karen Nicholson, I'll kick it over to you from the Haleon standpoint and products that may be considered for a patient presenting these sort of complications.
Sure. So again, you could take regular Advil, either the caplets, gel caps, or the tablets. But a nice alternative option is one of our newer products called Advil Dual Action, which is actually a combination of ibuprofen and acetaminophen. It's a fantastic product, works very, very well. So typically when you're taking Advil, ibuprofen, as I mentioned before, each tablet contains 200 milligrams of ibuprofen, and a typical dose is either 200 to 400 milligrams. And I think most people take two, so probably around the 400. And then when you're taking acetaminophen, the dosing is 325 or 500 milligrams of acetaminophen for tablet, and you take two, so it's usually 650 to 1,000 milligrams. The nice thing about Advil dual action is there is less of each actual ingredient compared to the monotherapy in each tablet. So one tablet of Advil dual action has 125 milligrams of ibuprofen versus 200 in the monotherapy, and has 250 milligrams of acetaminophen versus the 325 or 500. And then we have some really, really nice data in a study that was done on a dental pain model that showed patients who took the Advil dual action had more pain relief than patients who took either ibuprofen alone or acetaminophen alone. So you're getting better pain relief with less of each medicine in one tablet. And the fact that it's got these two different medicines, they have two different mechanisms of action. So you're really doing a 1-2 punch to pain, kind of covering all your pain bases in terms of, mechanisms of pain. So and they act synergistically to provide that really great pain relief with less medicine. So it's a win-win situation, really.
Excellent. Advil dual action definitely gives you that combination therapy, and instead of having to, it's also nice because you don't have to mess around with the different tablets and pills as well.
Yes.
Everything's there in that
Yeah.
one pill for you to take, and you know exactly what you're getting.
Yeah. But that being said, you shouldn't take this medication, the Advil dual action, if you're taking anything else containing an NSAID or containing acetaminophen, especially the acetaminophen. It's very, very important to stay under that 4,000 milligram or 4-gram max dose per day.
Excellent. Very important information there. Always read the safety warnings and making
Yeah.
sure that you're not combining medications with anything else that it shouldn't be combined with. Dr. Myrick, want to go back to you with this patient. What sort of recommendations do you have? And would you consider a return to physical therapy in this scenario? Or should they perhaps be going back to the imaging and radiologist to be able to see what's going on with that knee?
Oh, those are good questions. First of all, I just want to say I always recommend my patients take dual medications. So having that in one product would be so useful. Oftentimes, this is not an older patient, right? You said 59, but still taking medication every 4 hours and then every 6, they get very confused and it's difficult to keep on track. So I always tell them it's like when a kid has a fever, you're kind of adding the 2 medications on a different schedule and it's very helpful. So I'm real happy to hear about that. I think that this patient, you asked about physical therapy and imaging. I love our physical therapy colleagues. I love our interprofessionalism, and they go to school for 6 years to teach people exercises and to keep them in the game. So I absolutely love sending people to physical therapy. And oftentimes I learn something about that patient when they're getting that type of treatment. So I think it could be really helpful. Strengthening the muscles, not just focusing on the knee or whatever joint is hurting a patient, focusing on everything else around that is really key. So strengthening the muscles around the knee, the quadriceps, the hamstring. Again, the hip stabilizers are very big here, as is the core. It'll reduce their joint stress and improve function. So yeah, I would definitely send this patient to PT. Imaging can be a little bit tricky. We like to treat patients and not images. So, when we're looking for more information, so say this patient isn't getting better, they do PT and their symptoms are progressing. Maybe we're concerned about additional structural change. That's when imaging would come into play. It's oftentimes conservative management is a little bit better because we may see things on the image that we weren't expecting, and now we kind of have to treat them. So, we might just wait and see how that patient is doing. And then we just keep them going, their mobility, their strengthening, activity modifications, and then managing any kind of inflammation and discomfort, especially during flares.
Excellent. It's unfortunate MCL and ACL tears are sort of one of the most common athletic injuries, but from a product standpoint, you have that Advil dual action to be able to address it as the first line therapy. And then certainly when you're talking with your provider, being able to discuss, you have some options there, get back into physical therapy. And that, Dr. Myrick, that's not just going to the physical therapist, but also, sticking to that at-home regimen that they give you as well. No?
So important. Yes, indeed.
Excellent. So making sure that you're keeping up with those exercises. And then if it does get to the point of needing to go back from an imaging standpoint and seeing if there's any additional issues going on, that is something that's on the table as well. So Karen Nicholson, any final comments on this patient scenario?
Again, just make sure you're not taking anything else containing an NSAID or acetaminophen, and then again, ask your doctor if it persists more than 7 to 10 days.
Excellent. All right, we're going to move on here to our next scenario. This is going to be the final one that we address today. They're in their early 70s. They've been suffering from osteoarthritis in their wrists and hands as they've continued to age. So for almost a decade, maybe a little bit more, they've had these osteoarthritis issues happening. And they're still able to do most day-to-day activities, but occasionally are having issues when they're doing things such as typing on the computer, preparing food in the kitchen, and writing with a writing utensil. So, their day-to-day activities also being impacted by this OA. So, Dr. Myrick, let's start with the medical feedback and analysis with this patient.
Again, a common finding in primary care and in orthopedics as well, but osteoarthritis of the hands, we use our hands an awful lot. This is very common, especially as patients age, and this nice lady is in her 70s. It really can significantly affect quality of life. We mentioned things like, cooking and typing, and we communicate a lot now via typing, don't we? And so if she's trying to communicate with her family, even pay bills online, this is going to have an effect on her life. So when evaluating patients like this, we're looking at pain patterns, we're looking at joint stiffness, and also especially her functional limitations. The goal is really to make sure that we maintain her independence. So in this age group, that is really a key. So she needs to be able to function independently and comfortably on her own. And so we want to do that for as long as possible. And in many cases, conservative management will definitely work for a patient like this. Hand exercises, there's OT now, so occupational therapy versus physical therapy. They deal basically from the elbow down, so to speak. And so that would be that area that we would send her. Adaptive devices, things that she can open jars easier with at home. Some keyboards are a little easier to function than others, and she can get one that's maybe adaptive for her. And then managing her inflammation and any discomfort, especially when symptoms are present, would be important.
Excellent. Thank you. And Karen Nicholson, let's discuss the Haleon products for this patient scenario and what might be available.
So this one's my favorite. I'm biased. It's topical pain, pain relief. It's Voltaren Arthritis Pain Gel. It is a really fantastic product for osteoarthritis. It contains topical diclofenac, so it's a 1% topical diclofenac sodium gel. It's applied topically. You can use it on, we're indicated in 6 joints. So there's the hand, wrist, elbow, the knee, ankle, and foot. And you use either a 2-gram dose for the upper body, so that would be the hand, the wrist, the knee, or hand, wrist, elbow, sorry, or 4 grams for the lower body, so the knee, ankle, and foot. And there is a lot of clinical evidence supporting the efficacy of this product in both knee osteoarthritis and hand osteoarthritis. We do have a hand study, so this is perfect. And one of the really great things about Voltaren gel is the fact that it is a topical formulation. So again, similar to Advil targeted relief, you apply it directly to the site of pain. diclofenac is an NSAID. That's the main difference between this and targeted relief. So it's an NSAID, just like Advil, ibuprofen is an NSAID, has the same mechanism of action. However, since you're applying it topically, you're sort of bypassing the whole systemic absorption from when you would take a pill orally. What does that mean? It means that when you apply it to your skin, the diclofenac goes through the skin into sort of the fatty tissue underneath. It forms, it kind of builds up into what we like to call a reservoir. And then it sort of diffuses down into the tissues until it reaches the joint where it acts locally. And we have some PK evidence that shows that if you were to take a comparable dose, oral dose of diclofenac sodium compared to the topical application, you only absorb about 6% of what you would orally when you use it topically. So very low systemic absorption. This makes it really great for this type of patient. She's older, probably has a few conditions that she's taking other prescriptions for, and NSAIDs might interact with some of those, or she just might not tolerate NSAIDs very well taken orally. So this is a great option for patients like that who could really benefit from the pain relieving power of an NSAID, but just can't take an oral systemic dose. We also have a lot of safety data for this, the PK data that I mentioned earlier. And there's also a 1-year study that was done where patients use the product 4 times a day for the knee, for knee osteoarthritis, and was carried out for a whole year. And the adverse events from that study were very similar to placebo. And the most common side effect seen through all of our studies with Voltaren is application site irritation, which is very common for any topical product.
Excellent. I mean, Voltaren also, correct me if I'm wrong, but this is now a product that's available over the counter as well, correct, Karen Nicholson?
Yes, it is. It's OTC. And it's also recommended as first-line therapy from the American College of Rheumatology, ORSI, which is an international osteoarthritis research organization for osteoarthritis. And then Advil tablets as well, oral NSAIDs as well are also recommended first line.
Excellent. Thank you for that. And so Voltaren is an excellent option, especially in this case with, as Karen mentioned, an older patient who may be on other medications. This is a local treatment option directly to the area that's causing them that pain. Dr. Myrick, so this is a unique situation because OA doesn't go away, right? It's something that's there and sort of continues to persist over time. And I wish we could all reverse age in some ways, but that unfortunately doesn't happen unless anybody has some magic. But we don't know about it yet. Anyways, let's sort of talk about how do you address this patient and keep that mobility going, and so that their day-to-day impact, their day-to-day life isn't impacted too severely.
Yeah, for older adults with hand osteoarthritis, medication safety is one of the probably most important considerations in her treatment. So, of course, many patients like this have other medical conditions or medications, and the long-term use of NSAIDs can be really difficult for her. So a topical anti-inflammatory is the most helpful option. It's targeted relief. It'll affect her joints directly. She can continue to type and make some good food in the kitchen and be independent. And I think that it's really helpful, especially for the smaller joints in the hand. So I encourage her to stay active, encourage all patients to stay active and keep herself moving. And again, maybe OT, maybe some occupational therapy, because if her hand function is getting worse over time, that would help her to kind of keep that independence going.
Excellent. All right. For our audience, we've discussed these 3 different patient scenarios today. We've gotten fantastic input from Dr. Myrick and from Karen Nicholson on the Haleon team in terms of which products may be best incorporated into treatment plans. And this is all depending on their age, their injury, the complication that's been sustained. And then Dr. Myrick has been able to tell us sort of how do we address that in using the products that we've discussed, but also from a medical standpoint and keeping them going. So Dr. Myrick and Karen, I want to give you each an opportunity to provide any sort of feedback and comments on our conversation today. And so that patients, and maybe some tips for patients in terms of questions that they can ask and how they might be able to approach their providers, Dr. Myrick, with that. And then anything from your standpoint, Karen Nicholson, in terms of things from the Haleon side and maybe some resources and education for where folks can go for patients and providers as well. So Dr. Myrick, we'll go to you first, and then we'll go to Karen Nicholson.
Sure. So, I think one of the biggest and most important conversations that we're having in healthcare today is responsible pain management, and how to do this safely for patients. So patients want to stay active, they want to maintain their quality of life, they want to keep going, but they need the safest options for pain relief that are possible. So I basically emphasize to all of my patients and all of the clinicians that I train as well that it's really important to have a multimodal approach. So like we talked about physical therapy, occupational therapy, topicals, medications that they can take by mouth, and activity. So really kind of considering all of that. It includes movement, strengthening, mobility, rehab strategies. And then when appropriate, we really want to make sure that we thoughtfully use over-the-counter medications and items that can reduce their pain. Ice and heat are sometimes a wonderful modality as well. I do think both with patients and with future clinicians that education really is at the core of all of it. Patients need to understand how to use all of the modalities that are available to them, and clinicians need to be able to educate those patients and understand themselves. And just keeping everybody active and healthy is the goal for all of us.
Thank you so much, Dr. Myrick. Karen Nicholson, I'll give you an opportunity to have any sort of final feedback and comments on our conversation today.
Sure. So as I've been saying, make sure your patients are communicating with their healthcare provider before starting any new medication, even OTCs. And for more information, consumers or patients could go to Advil.com or to voltarengel.com for more information about any of the products that we've been talking about today. And for healthcare providers, we have a really nice site called HaleonHealthPartners.com. And it has information about not only our pain management options, but also all the other therapeutic areas that we cover. So that would be wellness, digestive health, oral health, et cetera, a few others. And so you will find pages there for HCP education for all of our product areas.
Excellent. Thank you for that, Karen Nicholson. The Haleon Health Partners site is fantastic. The NPACE and Haleon, as I mentioned off the top, have partnered. And so I know that there's another podcast that's available for folks to be able to listen to that we did with Richard, who works on the Haleon team. There's a few other resources that Haleon has developed outside of the partnership with NPACE that are available. So HaleonHealthPartner.com, fantastic resource for clinicians to be able to access, and patients, she mentioned those direct sites you can go to. I also want to mention that Haleon will be with us at our upcoming conference in Cape Cod. And so that's taking place June 8th through the 11th in Falmouth, Massachusetts. They'll have an exhibit booth there. They'll have some team members there to be able to ask questions to directly. So if you're attending that event or considering attending that event, please go ahead and visit our friends at Haleon there. Dr. Myrick, I apologize. Are you going to be with us at that event? I know sometimes you are, sometimes you aren't. Look at that, a 2-for-1.
Yes, I am. I'm so excited.
Excellent. So we're really excited to have Haleon and Dr. Myrick with us at that Cape Cod conference. Once again, that's June 8th through the 11th in Cape Cod, Massachusetts. I also want to give a big thank you. They're in the background today, but to Ryan Gellner and Emily Eddins helping to do some production and really did help us get things set up from the onset of this podcast. So a big shout out to them, 2 members on the NPACE team, for making things happen today. And some final words here just to wrap up our episode. A big thank you to Haleon for being our presenting sponsor, and to Dr. Myrick for making time in her schedule to be with us today. And for all of our listeners, we've talked about all the resources that are available, but in addition to those, for anything from an NPACE standpoint, you can check out npace.org for information on all things NPACE, our conferences, our learning center. We are an ANCC accredited provider for continuing education. We also have recently been accredited for physician associates. So PAs, please come join us as well at our conferences, as well as our online programming, npace.org for all of your needs. Big thank you to Dr. Myrick and Karen Nicholson for being with us today, and to our audience for tuning in. We thank everybody. We will see you next time on the Friends of NPACE podcast. Take care, everybody.